Hello everyone! If you click on this video, you probably heard about the controversial article discussing whether omega-3 is beneficial or worsen your condition. When I first encountered this article, news, or studies, it didn't surprise me at all, because it's always been like this when it comes to the supplements. However, many of my patients ask whether they should stop taking omega-3 or not. I thought it would be a good idea to share my views on this topic. I'll share what I found so you can have a clear view of this matter as well. It all started with the AHA, American Heart Association, and ACC's treatment guideline published on August 29th of 2023. Are you ready? Let's start right away. First of all, we have to look at this clinical practice guideline published by AHA and ACC. As you can see here, this isn't a study or research specifically focusing on effects of omega-3 on healthy individual or those with conditions like high blood pressure, diabetes, or hyperlipidemia. Instead, it serves as a guide for doctors in treating patients with chronic coronary disease. This comprehensive guideline spans about 110 pages, and interestingly, there isn't much mention of omega-3 within its content. Let's dive a little deeper into this section. It indicates that omega-3 didn't reduce cardiovascular disease events or death, meaning a possible slight effect or no effect. However, in this case of EPA, says it might be slightly beneficial for patients with CCD, and it's categorized as a 2B. And interestingly, the no benefit category, class 3, includes not only omega-3 but also vitamin C, D, E, beta carotene, and calcium. Let's take a look at the calcium part for a second. There were both benefit and drawbacks associated with calcium. Due to its dose-dependent nature, there is a slight reduction in the risk of cardiovascular issue. However, as the dosage increased, the risk also rise, displaying a U-shaped dose-response patterns. So this guide is telling doctors how to or not to prescribe supplements, even if those supplements are in a category called class 3, which means they don't clearly show benefits or risk, kind of like a neutral zone. But here's the catch. This guideline is for people with chronic coronary disease, not for everyone. So it doesn't mean we should stop taking omega-3 because of it's bad. There are still lots of good things about omega-3. Of course, as this guideline mentioned here, getting omega-3 from foods like fish is the best, but let's be real. Having fish every day isn't easy. So should we skip omega-3 just because it's labeled as having no clear benefit or effect? For example, taking arginine. You need to be careful with the elder people who have a myocardial infarction issue. But for healthy individuals, taking arginine doesn't mean they will have myocardial infarction because of it. Similarly, while omega-3 might not be particularly effective for patients with CCD, for healthy individuals and those with other conditions, it doesn't feel right to say don't take omega-3 just because it might not be super effective for one group. Omega-3 comes with a bunch of benefits like lowering cholesterol, relieving dry eyes, enhancing brain cognition, and reducing inflammation, among others. But here's the thing, omega-3 isn't a one-size-fits-all remedy. It's not like a medicine that shows the same improvement for everyone. And like I always emphasize, even if people have a same illness and symptoms, the pathological mechanism, the underlying causes, can be entirely different for each individual. Diet, genetic, lifestyle, these can all play a role. So because supplements aren't medicine, expecting identical results from them isn't realistic. The key takeaway here is that if we strictly view supplements from a drug perspective, we might conclude that none of the supplements, including omega-3, vitamin B, C, collagen, minerals, and others, it shouldn't work. However, it's a fact that while not everyone experiences the same result, many individuals do undergo dramatic changes and benefits from taking supplements. This is how I see supplements. They are undeniably challenging to prove clear effectiveness, unlike drugs, which are substances our body don't naturally produce. Supplements often involve substance that our body already have or can get from food. Take Tylenol for instance. Our bodies don't produce it naturally and it doesn't come from our food. So it's very straightforward to create two groups, one taking Tylenol and other not, to compare the effectiveness of its pain reducing effect. However, when it comes to the vitamin or omega-3, it becomes tricky to create two distinct groups because we naturally get this substance from our food as well. So determine which effect comes from supplements and which comes from food is challenge. The best we can do is control one group to have less of either food or supplements. But it's not as straightforward as dividing a group as we do with the drugs. Let me quickly share this video. In strength study on omega-3 conducted in 2020, it showed an increased rate of atrial fibrillation in the omega-3 group. Now, contrast that with a study from Harvard in 2023, which found a 10% reduction in atrial fibrillation with the omega-3 group. Why different outcomes? It boils down to control variables, meaning factors like eating habits, whether not eating, eating less, or eating enough. As I mentioned earlier, it's just tough to create a clear divided group because each individual body has a different baseline for each substance, right? Study says one thing in 2020 and another in 2023. This is why we will likely keep seeing these controversies in the supplement world for a while. So here's my suggestion. Please understand the difference between supplements and medicine. And if it's affordable, both financially and conditionally, why not give it a try? While supplements might not be as effective as the drugs, we cannot ignore their potential physiological benefits. How was today's video? We are living in a world where there is so much information, and sometimes it can be overwhelming, not knowing what to take and what to leave. But don't worry, I will do the studies for you. I will always do my best to provide you with the most up-to-date and easy-to-follow method to keep us healthy. Thank you for watching, and please leave a comment on how we can improve. We will minimize the sound effect from now on so you won't get distracted. Please share this video with your loved ones and don't forget to hit the like and subscribe to the channel. Happy New Year and let's go 2024. Until next time, stay healthy. Bye.